Good day and welcome to our training on Emergency Obstetric Care for Prime Care Nursing Practice. In the previous video, we explained how the kidneys, hormones, and blood adapt to support a growing pregnancy. We've understood how to spot the difference between these normal shifts and key warning signs of infection, diabetes, or blood clots. By the end of this session, the participants will be able to 1. Explain how progressive uterine growth and physiological adaptations affect positioning, spinal alignment, and the risk of supine hypotension. 2. Recognize the transition from normal maternal adaptation to active pathophysiology to proactively identify early warning signs of systemic failure. We will start with discussing how uterine growth and body changes affect maternal assessment and positioning. As pregnancy progresses, the uterus enlarges and the woman's body changes to carry the growing fetus. These changes affect posture, comfort, breathing, circulation, and physical assessment. The growing uterus shifts the center of gravity. Because of this, many women develop an increased curvature of the lower back and may complain of back pain or pelvic discomfort. Remember, relaxin also plays a role here, loosening joints and ligaments, especially around the pelvis. From an emergency care point of view, one of the most important effects of uterine growth is its impact on positioning. In late pregnancy, lying the woman flat on her back may reduce venous return and lead to supine hypotension. To prevent this, positioning her with a left lateral tilt helps improve circulation significantly. Understanding uterine growth also helps the clinician interpret abdominal findings more accurately. What is expected in pregnancy should not be mistaken for disease, and what is dangerous should not be dismissed as just pregnancy. Here is a key note to remember. Safe positioning is a vital part of safe emergency care. Good maternal assessment is not only about what the clinician observes, but also about how the woman is positioned during that care. Now we will look at when normal physiology becomes pathophysiology in pregnancy. One of the most important ideas in this session is that normal pregnancy adaptations can become dangerous when stress, illness, or complications push the body beyond its limits. For example, increased blood volume is helpful in pregnancy, but heavy bleeding after birth can still lead to life-threatening shock. Increased clotting helps reduce blood loss during delivery, but it also increases the risk of thrombosis and embolism. Relaxed, smooth muscle helps maintain pregnancy, but it may also increase reflux and aspiration risk. Higher metabolic and oxygen demands help support the fetus, but they also mean the mother may deteriorate more quickly during respiratory or circulatory compromise. This is where physiology becomes pathophysiology. The body's normal adjustments are no longer enough to maintain stability, and disease processes begin to overwhelm compensation. This understanding helps the nurse or midwife think ahead. Instead of waiting for a collapse, the clinician must ask, first, is the woman compensating? Second, could this normal finding become dangerous? And third, are there early warning signs that the body is beginning to fail? The key takeaway is this. Advanced practice requires more than just knowing normal changes. It requires recognizing the exact moment when normal adaptation begins to cross into danger. We have come to the end of this session. In summary, we explained how progressive uterine growth affects maternal positioning, assessment, and circulation. We understood how to recognize the precise moment when normal pregnancy adaptations cross into dangerous pathophysiology. Thanks for watching. See you in the next session. Bye for now.